I wanted to test that the cream was legit.
Well, the way to test the cream is legit is, once again, the cream's going to come down to the practitioner's experience with the cream.
I know, but before you keep going, let me just ask. This is an acceptable score just for the audience because I want them to make sure they're understanding. This to you guys is acceptable, knowing that I didn't put on the cream for 36 hours.
Well, that's kind of a crazy good level for somebody who didn't apply for 36 hours.
Well, I mean, in truth, I probably, because I've just started the cream literally probably that week, and previous to that, I was doing 2 injections.
Well, you probably had still some injection on board.
Yeah, that's what I mean. Right.
Okay, so this is not reflective of cream 36 hours later. There's no way. So what this is reflective of is what's still left on board from the injections. Okay. Because the cream, look, the great thing about the cream is this. Number one, you'll get great levels if you do it consistently. All right. But when I say consistently, it works great if you do it twice a day. Now, some people say once a day, but I recommend twice a day because it seems to work best clinically for most men. I said most men, not every man. I have several that do it once a day.
And me, I use it once a day when I'm on the cream, and that's what I do.
But so twice a day. And I found, as we've talked about before, the best time to measure it, the level that really correlates best with symptom resolution and a level that the patient likes, I like, symptoms seem to correlate very well. It's the 5-hour mark after you apply it.
Yeah.
So you measure the 6-hour mark, 12-hour mark. If you want to measure it at the trough, look, if you look at the pharmacokinetics, when you apply the testosterone, there's about a 23 to 25% reduction about 12 hours after your peak levels. And then about a 40% reduction about 16 hours later. So the point is that I guess if you wanted to measure it at some trough, if somebody, whoever the guy somebody that was given it and wanted to develop his own method of following, I guess, patients, he could test it at any time. I've tested it almost every time. And I just find that, once again, Rob uses that mark, I'm sure, as well. That 5-hour mark really correlates well. So that's what we like to see at the 5-hour mark. But many other clinics don't do that. They don't do that at all. So we would love to see it at 5 hours. But if you would have applied testosterone one time and then 36 hours later measured your levels will be less than 100 or 200.
Yeah,
they'll be low. So, one of the things, and this is from a doctor's perspective, sometimes you got to deal with colleagues who are they're just not knowledgeable. And so, when you have to share labs, sometimes you want to have your patient's levels lower so you just don't have to deal with the blowback from a colleague. So, there are reasons why we do
but this would not cause blowback, though.
No.
To be clear.
Oh, your levels would be great. Nobody care about that. Because
nobody would care.
Once again, prepare for that.
Just for the people out there, if I had applied cream and I had not been on injections previously and I just had put my cream on and I'm getting this test 3 or 4 hours later, what would it look like in a perfect testosterone level as you wanted to measure at peak?
It would be an acceleration, but not at peak just yet.
Okay, so be close.
That 5 to 6 hour mark is where you really kind of see that.
Peak is at 2 to 3 hours after application on the dosage that we use.
That's what I think too.
So, it's not really that we're measuring it at peak. Once again, you're measuring it at a time that correlates very well from a clinical standpoint with a level that looks acceptable to the patient and looks good to me.
Right.
And their symptoms, it correlates very well with symptoms. You got to understand the levels correlate with symptoms very well. All right. If you measured it 12 hours later and the level was 600, guys are going to say, "Oh my God, my level is only 600. This is not working." Mm-hmm. How do you feel? I feel great.
No.
Okay. But if we would have measured at 5 hours and it was 1500, then oh man, Doc, I feel great. I love that number. Everything. So you got to remember, there's a psychology to this in guys that they even though they don't want you treating based on a number, they want to see a number. And so if I wanted to have a much lower number, as Rob has alluded to, we could purposely measure 12 hours later, and there's going to be around a 25% reduction. If we want to even have it lower than that, we can measure 16 hours, going to be 40% reduction. If you waited on to the next morning, oh, you're going to be really low.
Yeah, it's going to be low.